Most men over 55 have been thinking about self-pleasure all wrong, and the silence around it may be quietly costing them their health. Today, that changes. There is a conversation that happens behind closed doors, in hushed tones, or not at all. And it is one of the most important conversations in men's health, one that most doctors skip entirely because they feel uncomfortable, because they were trained to move on, or simply because no one ever taught them to go there. But I am going there today, because you deserve the truth. If you are a man over 50 and you engage in self-pleasure, whether occasionally or regularly, you may have wondered at some point whether it is good for you, bad for you, or something you should have outgrown by now. You may have even felt a quiet flicker of shame about it, and that shame, it is not yours. It was handed to you by a culture that decided men of a certain age should not have desires, should not have pleasure, should not have a body that wants things. That is wrong. And today, we are going to dismantle that idea completely, with science, with compassion, and with the kind of plain honesty you deserve. Because here is what the research is now telling us. Regular, healthy sexual release, whether with a partner or through self-pleasure, is not a guilty habit. It is a biological function with measurable health benefits. And for men in their 50s, 60s, and 70s, understanding this could genuinely change your quality of life. Before I walk you through the science, let me introduce myself. I am Dr. Mariana, and I have spent years in clinical practice focusing on men's health, hormonal wellness, and the kind of conversations that most appointments never make time for. I have sat across from hundreds of men who carry unnecessary shame about their bodies, their desires, and their aging. And I have watched that shame dissolve the moment they are given accurate information and a space free from judgment. That is exactly what this channel is built for. If this is your first time here, welcome. Hit that subscribe button so you never miss a video. We post regularly on topics that your regular doctor may not bring up, but that genuinely matter for your health, your vitality, and your sense of self as you age. And right now, in the comments below, I want you to tell me, where in the world are you watching from? I love knowing who is in this community. Drop your city or country. Let's see how far this conversation reaches. Now, let's get into the real information. The first thing I want you to understand is what happens in your body during and after sexual release. Because once you understand the biology, the shame tends to quiet down very quickly. When a man experiences sexual release, the brain activates a cascade of neurochemical responses. Dopamine, the brain's primary reward molecule, floods the system. Oxytocin, often called the bonding hormone, rises significantly. Prolactin follows, which contributes to the feeling of deep relaxation and satisfaction afterward. And cortisol, the body's primary stress hormone, measurably drops. Think of it like this. Your brain has a natural stress relief valve, and sexual release is one of the most efficient ways to open it. It is not unlike the relief your body feels after a long run or a deep, full night of sleep. The system was designed to respond this way. You are not doing something wrong. You are doing something your biology was built for. For men over 50, this cortisol reduction matters more than many realize. Chronically elevated cortisol, which becomes more common as we age, is linked to disrupted sleep, increased belly fat, weakened immune function, and a higher risk of cardiovascular events. Any safe, accessible way to bring cortisol down regularly is a genuine health tool, and this is one of them. The second point I want you to understand involves your prostate. And this one surprises many men. Your prostate gland produces a significant portion of the fluid that makes up semen. When that fluid is not regularly released, it can stagnate within the gland. Over time, stagnant prostatic fluid is associated with inflammation, discomfort, and, according to a landmark study published in the journal European Urology, a higher risk of prostate cancer in older men. That same study followed nearly 32,000 men over 18 years and found that those who experienced higher ejaculation frequency had a notably lower risk of developing prostate cancer. The researchers described the relationship as consistent and statistically significant. Think of your prostate like a slow-moving pipe. Regular flow keeps it clear. Stagnation creates problems. Regular sexual release, whether with a partner or through self-pleasure, helps maintain that healthy flow. It is not indulgence, it is maintenance. Now I want to address something between our third and fourth points because I know some of you are reading along and still carrying that old weight. So let me ask you directly, when was the last time you gave yourself permission to think of your own pleasure as something that belongs in your health plan, not something to hide from it? Take a moment with that question, because the answer matters more than you might think. Your body is not broken, your desires are not shameful, and the conversation we are having right now is exactly the kind your health depends on. The third point is about testosterone, the hormone at the center of male vitality. As men age, testosterone levels naturally decline. This is well documented. What is less commonly discussed is the relationship between sexual activity and testosterone regulation. Research suggests that regular sexual activity, including self-pleasure, helps to maintain sensitivity in the body's testosterone receptors. Think of it like exercise for a muscle. The receptors that respond to testosterone need to be activated regularly, or they begin to lose their responsiveness. A man who remains sexually active, even through self-pleasure, is keeping those pathways open and responsive. Men who enter long periods of complete sexual dormancy sometimes report not just lower desire but also lower energy, lower motivation, and a kind of flatness in their emotional life. This is partly hormonal, and it is partly reversible. Maintaining some level of regular sexual activity, whatever form that takes for you, is one way to keep the testosterone system awake and engaged. The fourth point is about cardiovascular health, and this is where the science gets genuinely exciting. Sexual activity, including self-pleasure, is a form of physical exercise. During arousal and climax, heart rate increases, blood pressure temporarily rises and then falls, and circulation throughout the body improves. For older men, this kind of cardiovascular activation, done safely and without extreme exertion, provides a mild but consistent workout for the heart and vascular system. A study from the American Journal of Cardiology found that men who engaged in sexual activity at least twice per week had a significantly lower risk of cardiovascular disease compared to those who were sexually inactive. The mechanisms involved include improved endothelial function, that is, the health of the cells lining your blood vessels, and better overall circulation. For a man in his 60s or 70s who may not be running marathons, gentle, regular cardiovascular activation through sexual activity is a meaningful contribution to heart health. Do not dismiss that. The fifth point is about mental health and cognitive function, and this may be the most underappreciated benefit of all. Sexual release triggers the release of endorphins, the brain's natural mood elevators. It also stimulates the production of DHEA, a hormone that supports brain function, memory, and mood regulation. For men over 50 who face elevated risks of depression, anxiety, and cognitive decline, any safe and consistent source of endorphin release and DHEA stimulation is valuable. Beyond the chemistry, there is the psychological dimension. A man who maintains a positive, non-shameful relationship with his own body, who sees his desires as normal, as healthy, as part of being alive, tends to have a stronger sense of identity and self-worth as he ages. He does not feel erased by his age. He feels present in his body. That psychological groundedness has real downstream effects on sleep, on social engagement, on willingness to seek medical care, and on overall mental resilience. Now let me tell you about a patient. I will call him Robert. Robert was 67 when he first came to see me. He was quieter than most patients at the start, and it took a few minutes before he said what was actually on his mind. He told me he had been experiencing what he called low spirit, not quite depression, but a kind of hollowness. He had stopped engaging in any form of sexual activity about 3 years prior, after his wife passed away. He had assumed, without ever questioning it, that that chapter of his life was simply over. That men his age did not need that, or should not have it. When I gently walked him through the health research we have just covered, his expression shifted. He said, and I remember this clearly, "No one ever told me it was still mine to have." We worked together on his overall health plan: sleep, nutrition, movement, and yes, a normalized relationship with his own body and its needs. 6 months later, Robert described himself as having more energy than he had in a decade. The hollowness, as he called it, had largely lifted. I share Robert's story not because his path is exactly yours, but because his belief that desire and vitality have an expiration date is one of the most common and most damaging myths I encounter, and I want to address that belief directly now. If you are sitting with a version of the thought, "It is too late for me," I need you to hear this. Your biology did not get that memo. The body's capacity for pleasure, for release, for hormonal activation, and for the neurochemical benefits we have discussed does not vanish at a certain age. It changes. It may slow, it may require more intention, but it does not disappear. And your dignity, your right to exist fully in your body, to experience pleasure without shame, to take your own health seriously in every dimension, that does not expire either. Dignity is not something you earn when you are young and surrender when you are old. It is yours. It has always been yours. And caring for your body's needs at every stage of life is not weakness. It is wisdom. Let me bring all of this together for you in a simple action plan. 1. Normalize the conversation with yourself. Stop treating your body's needs as something to hide from your own awareness. Name them, understand them, and bring the same neutrality to them that you would to any other biological function. 2. Aim for regular sexual release, with a partner if you have one, or through self-pleasure if you do not. Research suggests that somewhere in the range of 2 to 4 times per week is associated with measurable health benefits, though any regular frequency is better than complete dormancy. 3. Pay attention to your prostate. If you notice discomfort, pressure, or changes in urinary flow, speak with your doctor. But also understand that regular release is part of prostate maintenance, not something separate from it. 4. Track your mood. Notice whether you feel more energetic, more emotionally steady, or more mentally clear in the days following sexual release. This is not imagination, it is neurochemistry. Let your own experience teach you. 5. If shame is a persistent presence, examine where it came from. Most of the time, it was inherited from a culture, a generation, a set of messages you received early in life that were never accurate. You are allowed to set them down. Your 30-day challenge. For the next 30 days, make a deliberate choice to treat your sexual health as part of your overall health, not separate from it, not hidden from it, and not something you feel you have to earn or justify. Notice what changes. Thank you for being here today. If this video helped you think about your health in a new way, please like it. It helps more men find this information when they need it most. Subscribe to this channel so you do not miss what comes next. And in the comments below, I want to hear from you. What is the one thing from this video that surprised you most? Share it below. Your response might be exactly what another man in this community needed to hear. Remember, aging is not the end of vitality. It is an invitation to live smarter.